Hello friends, in this video we are discussing some of the image based questions. First question, name the device in the image. Option A, Eurobag. Option B, external ventricular drainage. Option C, intercostal drainage. Option D, closed wound drain. The correct answer is option B, external ventricular drainage. An external ventricular drain or extraventricular drain is a device used to relieve elevated intracranial pressure when the normal flow of cerebrospinal fluid (CSF) inside the brain is obstructed. The purpose of external ventricular drainage is to divert CSF from the ventricle of the brain and also for monitoring of intracranial pressure. Second question is, what is shown in the picture? Option A, Sengsteken-Blakemore tube. Option B, three-way Foley catheter. Option C, Ryle's tube. Option D, suction catheter. The correct answer is option A, Sengsteken-Blakemore tube. The Sengsteken-Blakemore tube is used to stop or slow bleeding from the esophagus and stomach. The bleeding is typically caused by gastric or esophageal varices, which are veins that have swollen and obstructed blood flow. The SP tube has three ports with different functions. First port, esophageal balloon port, which inflates a small balloon in the esophagus. Second port, gastric aspiration port, which removes fluid and air out of the stomach. Third port, gastric balloon port, which inflates a balloon in the stomach. At the other end of the SP tube are two balloons. When inflated, these balloons put pressure and stop bleeding. Third question is regarding Minnesota tube. Minnesota tube has an esophageal aspiration port in addition to the gastric aspiration port. In Sengsteken-Blakemore tube, there is only gastric aspiration port, but in Minnesota tube, there is another esophageal aspiration port. Next image is of PIGTAIL catheter. PIGTAIL catheter is used for draining the pleural fluid. In case of fluid collection in the pleural space, we use this catheter to drain the pleural fluid. Next image is of T-tube. T-tube is a draining tube placed in the common bile duct after common bile duct exploration. It provides external drainage of bile into a controlled route while the healing process is supported. The next image shows central venous catheter set. A central venous catheter or central line is a catheter placed into a large vein like veins in the neck, that is internal jugular vein, or chest, subclavian vein or axillary vein, or groin, that is femoral vein. It is used in critically ill patients and those requiring prolonged intravenous therapies. This slide shows the gauge size of various intravenous cannulas. We can see that as the gauge size increases, flow rate of the cannula decreases. This you should keep in mind. The cannula having the highest flow rate is of gauge size 14 and cannula having the lowest flow rate is of gauge size 24. This slide shows incentive spirometer. An incentive spirometer is often given to people who have recently had surgery, people with lung disease, or people with conditions that fill their lungs with fluid. Incentive spirometer improves lung function and strengthens the lung, reduces mucus blockage, reduces the incidence of lung infections. This slide shows pneumatic compression device. It is a sequential compression device for the prevention of post-operative deep venous thrombosis. It is applied to the lower limbs and it prevents post-operative deep venous thrombosis. This image shows a suction apparatus. Suction machines are used to remove substances such as blood, saliva, mucus and vomit from a person's airway. So, by using this device and suction catheter, we can clear the airway.